The best candidates for spinal fusion surgery or other aggressive treatments are those who have focal pain symptoms and have a very well-defined pathology or disease process to account for their back pain. For instance, the most common reason for fusion surgery is an unstable spine, and we can pick that instability up by looking at x-rays. But in those patients without instability, they at least need a study called a discogram that would help to suggest the presence of a single disc as the source of their pain. Now, having said that, patients certainly need to have exhausted all reasonable non-surgical treatments over a reasonable time frame, such as at least a 6-month period of time, and have given an honest effort to those treatments before proceeding to any consideration about surgery. Now, having said that, then, patients who have rather regional or diffuse pain, and particularly those who have a lot of psychological overlay to their pain problems, don't tend to do well with fusion surgeries and they're therefore not looked at as good candidates. The final points are that patients need to be realistic about their goals for this procedure. The example that I like to give is that a typical fusion patient will reduce their pain from 7 out of 10 on a 0 to 10 scale before surgery to something like 3 to 4 out of 10 after surgery. And so patients who come into this procedure thinking that they will be cured will obviously not have a favorable outcome. And finally, we look at patients who are motivated, not only motivated to maintain their health in other ways through trying to maintain their fitness as high as they can and eating right, getting proper sleep, but also motivated to follow through with the postoperative rehabilitation that's required, as well as looking at cessation of smoking if that's been recommended, and eliminating the use of prescription narcotic drugs.